It's the end of week 4 up here at the Legislature. We're happy to see more people here on the Hill than we saw last year, and I would just invite any folks that are interested to come up, and with the time that we have, we'll try to find a moment to talk to you. It matters to have that interaction, and so I'd appreciate seeing more constituents on the Hill. We have a lot of important things going on right now, as you can imagine, and for those of you that are following the bills, you have a good idea of what's going on. We have a school choice bill that's coming out. A survey was done by Dan Jones and Associates indicating that parents want more options for their child's education. And so this bill is looking at ways to give you more opportunities and more options to consider private school, charter school, and or public school, and or even a hybrid of that. So that's good news, and more debate will go on in that bill coming up. The other bill that might be of interest to you is the vaccine passport bill. It probably would have been more aptly named the anti-vaccine passport bill, but that bill is going to be heard in the next week or so, talking about more restrictions against things like passport requirements for vaccines, against requirements to show medical records, and really in violation of federal law, which is HIPAA, which protects your medical records. So be watching for those. I have a bill coming up that's going to look at restricting employers even further and what they can ask their employees to provide to them, because again, your medical records should be private, and you share them with those who you want, but you shouldn't be forced to do that. So we're busy, we're fast and furious. We have a lot of school children come up, and we're always happy to see them. So stay engaged with us. I'm working a few other things that might be of interest to you, some health care bills, and just trying to make sure that patients have the most access to health care. So a few other bills that you'll see up on the Hill is a bill to grant optometrists more medical access to their patients. That bill is being debated right now. We have not come close to voting on it, but will. There's another bill that would bring in anesthesia assistance to the state, and I've heard from many of my constituents that are nurse anesthetists against that bill, and so everybody has an opinion and an objective, and so I just want to hear from you. I appreciate you responding to my survey. I'm reading those now, and these things matter to me because I need to know how you feel on the issues. So as always, contact me anytime. My cell number 801-372-5350. Look forward to hearing from you. Thank you.